22-year-old female, Stella, who was brought in by her friend. The friend states that he went to visit her and she was complaining of really bad chest pain and wanted to be taken to the hospital.
Hi, my name's Desiree. How are you feeling today?
Hi, I have a lot of pain.
Pain? When did it start?
It started a while ago. It got more intense now though.
How did it start?
Well, I'm a little bit ashamed to say this, but I'm in school and I've been extremely stressed out, and the only thing I could find that helps me to relax is cocaine. And yesterday I might have overdone it.
Okay, yesterday. How were you feeling?
Yesterday?
Yeah.
It was horrible. I felt like I had pain in my chest area, like something was crushing it, like so much pressure and like in one spot. But I also have a lot of pain in my left arm and my neck and my back.
Okay, has that been ongoing or was it just when it started?
It comes and goes. It depends. It depends if I'm using.
How often have you used before?
It's been a while on occasion, but lately it's been more frequently.
More frequently? Okay. How would you rate your pain on a scale from 1 to 10?
A 10 for sure.
10 for sure. Has it been that way the entire time or is it come and go?
It comes and goes, yeah.
Okay, when does it feel the worst?
I think it feels the worst when I lay down, or if I move, then it just gets more intense.
Okay, is there anything that you've noticed that helps make it a little better?
Honestly, I haven't found anything. That's why I had to come, even though I'm really ashamed of what I've been doing.
So we use cold spot assessment questions to better assess the pain the client's in. Cold spot stands for character, onset, location, duration, severity, pattern, and associated factors.
I'm gonna go ahead and get started with all your vital signs, okay? So we're gonna get this checked out for you. Okay, so I see that your blood pressure is a little high and your pulse is also pretty high and your oxygen is kind of low. So we're gonna go ahead and get you set up to go get an EKG to check out your heart and also get you set up for some oxygen and get some pain medication for you, okay? All right, I'm gonna go get the doctor. I'll be right back.
Thank you.
How are you feeling?
Very short of breath.
Short of breath? All right, well, we are going to hook you up to the EKG machine to get you checked out, okay? There you go. There's one. Okay, so I'm gonna put the oxygen on you, okay, so we can get some O2 levels raised. That's good. Here we're gonna put your IV in so we can get your pain medication started. There you go. Okay, and the doctor will be right with you.
Hi Stella, this is Jonathan. May I come in?
Yes.
How you doing? I'm the nurse for today. How are you feeling today?
I have a lot of chest pain and I have pain in my back. I feel really short of breath. I'm super anxious. I feel like throwing up and my head, I feel so lightheaded.
Okay.
I'm tired.
Sorry you're feeling that way. I just want to ask a quick question. Do you have a family history of any underlying conditions?
Yeah, my dad died of a heart attack when he was about 60. And my mom also died because she committed suicide. She was very depressed.
All right. Well, what about you? How are you doing? What's your personal life like?
Well, I work full-time and I go to school full-time. I'm trying to become a civil engineer. So it's really hard to manage my time. And I'm surrounded by a lot of negative people. My roommates are assholes and very unmotivated. They make me feel stressed out, and that's why I turned to cocaine.
And can you describe to me your daily lifestyle, any like exercise habits or dietary?
Oh, I don't have time for exercise at all. When I eat, I just go to McDonald's or Burger King. My favorite food though, KFC, fried chicken.
The definition of subjective data is anything the client can verify: symptoms, desires, beliefs of the client. The reason we use subjective data is to find cues in sociological, psychological, and physiological strengths and weaknesses of a client. So chest pain is very broad. It can originate from cardiac, but it can also originate from pulmonary diseases, gastrointestinal diseases. So we use subjective data to make it to have more of a focused point of view to see what the disease was. So when looking at subjective data, you first look at her family history. Her family has reports of cardiac disease and heart problems, so she has a predisposition of heart problems. In addition to that, her father had myocardial infarction, or an MI, at the age of 60, so she has a predisposition for MI. Plus there's added stress to her life when you look at personal history, because both of her parents just passed away, which adds a lot of stress. Then she goes to school full-time and works full-time, so that's added stress, which led her to cocaine use. And then when looking at her lifestyle, she has a very sedentary lifestyle. She sits around, she has no workout routine, and she has a high-fat diet, which are all risk factors.
So now we're moving on to objective data, and objective data is anything that you can measure or observe from the patient. So things that you can prove, like physical assessments, lab tests, anything you can observe. So for Stella, we're moving on to her vital signs now. So Stella's blood pressure is elevated at 130/72 because stressful events like an MI cause increase in hormone levels like adrenaline, and your sympathetic nervous system is going to go into overdrive, which causes that increase in blood pressure, because the nervous system is your fight or flight system. Looking at her respiratory rate, it's 24 beats per minute and normal is 12 to 20. So her respiratory rate is actually elevated, and this is because she has poor perfusion, meaning that she cannot get enough oxygen to the cells and tissue. So now, because of the inadequate oxygen to the cell and tissues, her respiratory rate is going to increase. So her pulse oximetry is less than 90, and she's supposed to be at 95%. So this is also due to her poor perfusion.
So continuing on with the objective data, we did a full head-to-toe assessment, and some of the findings were that you can see that she is distressed. She's clutching her chest, and you can see the pain in her face, and the color of her skin is pale and cool to the touch. Her respiratory quality is labored and shallow because her body is trying to compensate for the low oxygen.
When auscultating the lung sounds, we heard crackles, and this is because the heart is tachycardic, so it's working really fast. It's not allowing the heart to refill completely before it pumps up the next round of blood. So now the blood is backing up into the right side of the heart, eventually going into the lungs. Therefore, rhonchi in the lungs, which is that crackling noise that you hear.
So after analyzing the objective and subjective data, I'm going to be using my handy dandy nursing diagnosis handbook. Stella has activity intolerance, anxiety, ineffective coping, family coping, and ineffective health maintenance, and risk for decreased cardiac tissue perfusion.
A patient came in this morning for chest pain and other symptoms associated to our suspected diagnosis of acute myocardial infarction. To further test this, we perform a blood test which examines troponin levels in the blood. Since the patient's troponin level in the blood is above 0.40 nanogram per milliliter, this means that a person can have a risk factor of chest pain for MI. The usual amount of troponin is low in the normal individuals. This means that Stella's blood flow in the heart is being cut off. We also perform an EKG and notice that Stella's ST segment and T wave are both elevated. This means that If both of these ST segments and T waves are elevated, then it indicates an infarction. To determine the type of acute myocardial infarction, we also perform a urinalysis. Upon testing her urine, we found that there is a presence of benzoylglycanin. It's a metabolite of cocaine with a level of 350 nanogram per milliliter. We tested this in the morning when she was admitted to see the highest concentration of this metabolite. The other test that we perform is the echocardiography. We use this examination to help us determine the location and the extent of the MI. It is a test of the action of the heart using ultrasound waves to produce visual display. Upon conducting this, it shows that during an acute myocardial infarction, the left ventricle of Stella's heart is not getting enough oxygenated blood to the tissues of the body. After conducting all the tests and as we observe all the data, we are diagnosing you with acute myocardial infarction and left-sided congestive heart failure.
Oh my gosh! I can't believe this.
So the initial management is giving the oxygen, the IV benzo, nitrates, calcium channel blockers, and the aspirin to help alleviate chest pain, to lower the heart rate and blood pressure, and for the oxygen deprivation. Due to the coronary vasoconstriction, which increases the heart rate, there is an oxygen demand in the heart. So the treatment that we're going to give, the nitroglycerin and the calcium channel blockers. So this medicine will vasodilate the coronary and relieve the myocardial oxygen demand. So the heart will relax and it will alleviate the chest pain. So another treatment is the benzodiazepines. This will decrease the cardiovascular sympathetic response and relieves the symptoms. This will decrease the anxiety, decrease the agitation, decrease the heart rate, and decrease the blood pressure. So due to the increase in platelet aggregation, there will be a possible formation of the thrombus. The treatment for this is the aspirin to get rid of the thrombus. Since Stella presents an ST elevation on the ECG and she is diagnosed with having myocardial infarction, Stella will receive thrombolytic therapy intravenously. This will break up or dissolve the clot in her heart. So the most important long-term intervention for cocaine user is to enter the patient into a substance abuse program and also to educate the patient about the harmful effects that cocaine has upon the heart.
Do you know what the diagnosis is? I can't hear you. That's right.